This morning, we have two special guests here to discuss ocular health, specifically a disease called dry eye. According to a 2008 Gallup study, 90 million Americans, 90 million, have two or more symptoms of dry eye. Joining the Balancing Act this morning as part of our dry eye series is Dr. Paul Karpecki. He's here to talk about the symptoms and remedies for this often overlooked disease, along with Sandy Oliver, who has suffered from dry eye. Good morning.
Good morning.
Thank you so much for being here.
Wonderful to be here.
Sandy, thank you. Now, before we talk about this, I want my viewers to know your story. So take a look at what Sandy has suffered through and what she's done about it.
My name is Sandy Oliver. I'm a high school teacher. As a teacher who does a lot of reading, I would have these watery eyes, they would ache, they kind of burn a little bit, but just figured age. I didn't really pay much attention to it. I didn't realize really how serious it was until I saw the ophthalmologist. I was using some over-the-counter drops because just to, get the red out, get relief, and when I started with the prescription drops, I could tell a difference. The watering, the excessive tearing, slowed down a lot. I guess one of the side effects of this condition is how it affects your everyday life. Just getting ready for work in the morning, it takes longer. I've got to do my prescription drops before I leave. As a teacher, I try not to let this be a big deal with my students because I don't want them to think, their teacher's not coping. But I just find times in between classes. I have to take breaks when I'm grading papers or whatever and just rest my eyes. I'm understanding that it's supposed to, improve over time. So we're in the beginning of this journey. It does definitely affect life, but when life, gives you lemons, you make lemonade. So that's what we're working on doing.
Sandy, you've been through a lot. Tell me a little bit more about the symptoms and what it's done to you.
Well, when it first began, I just all of a sudden began to consider my eyes. All of a sudden I'm feeling them, and they just felt like when you go to the beach and you're out in the wind all day and you just have that kind of irritated feeling. It just became where that's all I ever felt was, and I just had never had that before. And then you just think, well, that's just part of getting older.
And then you realize, no, it was a little bit more than that.
Yeah.
Dr. Karpecki, let me bring you in now. Are certain people more prone to being afflicted with dry eye?
Absolutely. In fact, there's a lot of predisposing factors that can contribute. Some are, the female gender, a little higher incidence of dry eye. Some are age. Some are the environment, people who are on the computer a lot, people who spend a lot of time out in the wind, people with certain systemic diseases like diabetes or arthritis, as well as certain medications can dry the eyes out.
Really?
Antihistamines, certain types of diuretic medications can also contribute. And then contact lens wear, as well as even surgical procedures of the eye, can contribute to a temporary dry eye.
All right, so keep it simple here. What is exactly dry eye?
Well, dry eye, according to the DEWS report, this was a dry eye workshop of some of the top experts in the world. They defined it as a multifactorial disease of the tears and ocular surface. What they mean by multifactorial is all those contributing factors we just mentioned. But it results in symptoms of discomfort, much like Sandy described, visual disturbances, and tear film instability. It's accompanied by increased osmolarity, and what that means is the salts are out of balance with the water in the tears, and so you get this symptoms that contribute like burning and other factors we'll talk about, and it results in the end in inflammation of the ocular surface.
And Sandy, as you were feeling all of this, I can only imagine that it affected your everyday living.
Absolutely. One thing that really bothered me was reading. I wear reading glasses, and so then again, age. I just can't read like I used to. I'm a teacher. I'm on the computer a lot, and so I get to a point where I have to shut down. I have to turn off the light.
So, doctor, this can really affect the quality of life. I mean, this is nothing small.
That's a great point, actually, Christy, because there was a study in Ophthalmology Journal, I think it was July of 2003, that actually looked at quality of life symptoms of patients with dry eye. And the most amazing thing that came out of it is that it showed that the response in terms of the effect on someone's quality of life actually came out to a score of 7.9. That doesn't sound like much to all of the people listening, but what that really means is if you look at conditions like chronic heart pain, they actually have a score of about 7.8. So it's a really significant disease as far as quality of life.
Oh my goodness. Now, let me ask you something. If I go to the doctor, can I get a diagnosis? Is there a certain exam where someone can then say, okay, this is what you've got?
Absolutely. And that's continued to advance as well. I mean, all the basic exams for dry eye, we'll start with a questionnaire, some sort of history that goes into common symptoms like we described, many of the ones Sandy described very well. Then once you have an idea that's a possible diagnosis, then we go into kind of tests that are specific to it to help us with our indication and our diagnosis.
Oh my goodness, what kind of treatment helped you, Sandy?
Well, I'm taking a prescription drop and then the over-the-counter drops several times a day.
So no matter what, they should really go to the doctor, see what's going on, and get a successful treatment at the end of the day.
That's an excellent point. I think so many people think of this as kind of an age condition like you described, and it continues to progress, and so they just use artificial tears. And they are helpful because they're palliative, but they don't really treat the disease. You really need something that's a prescription and targets into the disease, such as the ones Sandy just described. One of my favorites is Fresh Coat. It's a prescription again, so you have to see your doctor. But it works really well in terms of all 3 layers of the tear film and even the complications of dry eye itself.
Excellent information. Doctor, thank you.
It's a pleasure.
Sandy, thank you. And I'm glad you're doing much better.
Thank you.
Those eyes don't hurt anymore. And you've got beautiful eyes.
Thank you.
And if you want more information on dry eye, just go to freshcoat.com. That's coat with a K. K-O-T-E. Check it out. And make sure to keep watching our Dry Eye series for more useful, fabulous information.